Hi, my name is Katerina Zaka. I'm an internal medicine resident at Wellstar Atlanta Medical Center, and today I will be presenting lung metastasis from uterine papillary serous carcinoma, a case report. As an introduction, uterine papillary serous carcinoma is a rare variant of endometrial cancer that is highly aggressive, with a propensity for distant metastasis and is associated with very poor outcomes. The lung is the most common site of extrapelvic metastasis with an incidence of 6.1%. In terms of the case presentation, a 64-year-old female with a past medical history of hepatic lesion status post-needle biopsy that was positive for inflammation and negative for malignancy, and a perineumotic effusion status post-thoracentesis presented to the emergency department with a dry cough of 4 weeks duration. This cough was associated with intermittent subjective fevers, chills, fatigue, unintentional weight loss, and a 10-month history of postmenopausal vaginal bleeding. On presentation, the patient was hypoxic with a PaO2 of 64 on room air, tachycardic, and labs demonstrated a hemoglobin of 6, requiring 3 units of packed red blood cells during her admission. She was started on vancomycin and piperacillin tazobactam for suspicion of community-acquired pneumonia. A computed tomography demonstrated innumerable bilateral pulmonary parenchymal nodules in all lobes of the lung of varying size up to 3.4 by 3.2 centimeters. CT of the abdomen and pelvis demonstrated marked soft tissue expansion of the endometrial canal and cervix, a 4.3 centimeter heterogeneous mass representing a pedunculated subserosal fibroid, and resolution of previously identified irregular cystic lesions throughout the liver. In comparison, CT chest, abdomen, pelvis 10 months prior to admission showed mild areas of atelectasis in the right lower lobe, 15 to 30 hypoattenuating liver masses, and markedly enlarged uterus with multiple fibroids. A core lung biopsy was performed, and pathology revealed high-grade serous carcinoma. A cervical biopsy revealed stage 4 uterine papillary serous carcinoma. She was then treated with Taxol and carboplatin. However, the patient developed respiratory failure with mechanical ventilation dependency and acute renal failure requiring hemodialysis. The patient and family at this point elected to proceed with hospice care due to her clinical decline, poor performance status, and poor prognosis. The patient unfortunately passed away after a 16-day hospital course. As a discussion, UPSC only accounts for about 3 to 10% of endometrial cancer. However, it accounts for 40% of endometrial cancer-related deaths because it is more likely to be diagnosed at an advanced stage. The rapidity with which her disease progressed was remarkable, with extensive metastatic pulmonary lesions too numerous to count at the time of admission. As you were to see, in figure 1, the chest x-ray was performed in May 2020, and in figure 2, chest x-ray performed in April of 2021 revealed this markedly progressive metastatic pulmonary lesions in comparison to 1 year prior to presentation. Thank you so much for your attention.